I work at the Genesis Hospital. I do pediatric outpatient therapy with kids typically junior high or younger, and I've been there for only 2 weeks so far, and I got my master's and undergrad through St. Ambrose. So far right now with my new job, we're spending mornings doing a lot of trainings, and then the afternoons with after-school kids are packed so far. And usually they're half-hour, 45-minute sessions, working on different skills that they need worked on. Typically my day ends about 6:30, doing documentation at the end, updating notes, and then charging for insurance. It definitely changes depending on the client. Some kids need more help with their fine motor skills, like handwriting or zipping things and getting dressed on their own. So whatever they need to work on, occupational therapy focuses on the occupations of, for me, pediatrics, so occupations of a kid. So playing, schoolwork, getting themselves dressed, washing their hands, washing their face, anything that may be difficult for them, jumping, running, playing, anything along those lines. So working on making sure they can do those skills. I really enjoy kids, and I really feel like that's my calling, and I enjoy the adult and older adult population, but I decided that while I'm young and energetic, I'd like to be a part of pediatrics. It depends on the setting, but I would say that's pretty typical. Right now I work 4 10-hour days, and then I have Fridays off, so that's a very nice perk from my job. I'm not sure exactly. I would say starting level would be typically between maybe 40,000 and 55,000 in this area, but it definitely is higher in more rural areas and probably at the 2 coasts. So the traveling therapists would definitely get more money. They're typically in a hospital setting for 2 to 3 months, and then they rotate to different places. And then nursing homes or skilled nursing centers with the elderly, I'd say typically around this area have a little bit higher pay. Well, it's a 3-year master program, and the first 2.5 years are coursework, and in that coursework there's different weeks that you do clinicals in different settings. 2 in pediatrics, I think 1 in adults, and a longer 3-week one in the elderly population. And then the last 6 months of our schooling we spend on 2 12-week rotations. So 3 months I was in a hospital in Iowa, a rural hospital with adults, older adults, and home health, and then I spent 3 months in Des Moines doing pediatrics. I did 2 days of hospital training just to learn about the health system, and then in the mornings it's learning a little bit more about documentation, the protocols in the department that I'm at, and also some of the therapists I'm working with have some more skills that aren't exactly entry-level skills, so they're keeping me up to date on what certifications I need to learn those skills, or ways that I can get more familiar with them right now until I get certified in them. I have family friends in Iowa City, where I grew up, that had 3 boys, and I was babysitting them, and the mom got pregnant and her daughter was born with some special needs. And so from the very get-go I just continued babysitting now then for the 4 kids, and I started doing respite care, which is it's a service provided through the state of Iowa if they have a mental retardation waiver, and so it gives a break for the families and it's paid through the state, sort of like babysitting, but you can work on specific goals for the kids so they can improve on whatever skills. So that's kind of how I got involved, is doing respite care. I did that all 4 years of high school, and then when I moved here, I continued doing it in Bettendorf, doing respite care for kids that have disabilities. There's the neonatal intensive care unit, where they work on regulating baby systems so that it's similar to being in the womb, because they were born prematurely. And so if they're in a hospital, there's typically a lot of stimulation, lights, doctors coming in, touching them, probing them, and that's not very good for their system. So occupational therapists can go and make sure that their environment is as good as it should be so that they get the best development that they need to. Then there's preschool age, and that can be through like the school district still, or through an outpatient clinic like I am for pediatrics. Then there's school-based care, and then adult care, and that can be inpatient. So after someone has a knee or hip replacement, they'll need therapy to learn how to dress themselves again. Or it can be outpatient, maybe for someone that has fibromyalgia or arthritis, just learning how to move better to protect their joints. And then elderly, same sort of things as with the adults, or if they have a stroke, reteaching them how to use skills that only use one side of their body, or other adaptive ways. Right now I'm still in transitioning, but I'm really enjoying my patients, and even though they may not be able to do some of the things as easily as you or I may be able to, they have a lot of other gifts and talents, and that's what's pleasurable to see, is all the other things that they can do. The documentation and paperwork will probably be the one thing that I don't enjoy as much. I'd much rather be dealing with people than doing paperwork. It is required for my field. I think the first year you don't have to do as much of it, so I haven't looked into it too much. But then the following years you have to continue with keeping up your license and registration. But since the first year you just take the exam, they figure, I think, that you're pretty up to date, and so you have to do a few less courses. And you can choose the courses that you want to do. It can be in your specialty area, so I may take some on sensory integration with pediatrics, or it can be a totally different area that maybe I want to get into in the future, so traumatic brain injuries. And you just gather and you keep track of how many credits it is, and then there's certain regulations for the state and license board. I think you have to be willing to be a patient person, because a lot of times people are dealing with things or disabilities that require more time to complete tasks that they're asked of. Flexibility, being able to think on your feet, and being able to think of different ways to complete tasks that may seem off the wall but may make someone else's life really easy. If, instead of, they can't get themselves dressed and button their pants, well, maybe people didn't think to just buy elastic pants, and that could make the difference of them having to get a home health aide to come in every morning and help them get dressed, and just adapting what they're doing is just buying different clothes or other things like that. Definitely doing the respite care helped. I had a big background in working with kids and people with disabilities. I also volunteered for 4 years with a Girl Scout troop that were girls that had disabilities. So that took some leadership skills, and then again working with that population. So I think that really helped. I don't think I do too much different. I did take Spanish in high school, and I enjoyed that and went on a few trips. So maybe I would have kept up Spanish, because I know that'll still be useful in my job. But I think if I needed to, I could probably brush up on it pretty quick and relearn it without taking the courses, but maybe that would be the only thing. Yeah, there is, you can always get, I think, more pay as you stay longer in the position. There's always management positions. It would really depend on what your personality is and because as you're doing more management, you'd have less patient time. So there's advancement, but it's always a give and a take of what you gain and what you'll lose in your job and in your position. The one thing I did like about occupational therapy, which also helped me to choose it, was that if I decided I wasn't interested in pediatrics anymore, then I could switch and do something in a nursing home for a while or something in the hospital. So I really felt like it gave more flexibility than my actual original choice was possibly special education. And I knew I would only be able to do that in a school. So this way it's not necessarily advancement, but it's having the flexibility to switch what I'm doing. I would say probably short-term challenges would be keeping up to date because it's an ever-changing area with medicine and technology, and just keeping up to date. I think that entering the program, it is a close-knit group of people, and the teachers are really willing to help you out, but you have to also be willing to put in the effort. And coursework does at times get busy and heavy with group projects and being flexible with everyone in the classes. So being able to know that as you're entering this program that it's a professional program, and being prepared, nothing is over what you can do, but you have to be able to work with it a little bit, and the teachers will give back 100% of everything because they're really hard workers and make sure that we succeed in the program. So that was really nice when entering this program. I think the best career advice is probably from my mom, and it's always just go into it with an open mind and with a smile on your face, and no matter what happens, even if it isn't exactly what you expected, you can make it be what you want it to be. It's all in your outlook.